Hello again, everyone. Mark Hackle, Macomb County Executive. John Paul Ray, our Deputy Executive, just updating you on what's going on with the COVID crisis here in Macomb County, kind of how it relates to the state. So numbers, obviously they keep trending upward, and unfortunately we keep talking about them growing, but the reality is we're starting to see at least kind of daily kind of plateauing. But what are the numbers today?
Yeah, Mark, when we're looking at the totals right now, just over 4,500 cases here in Macomb County and unfortunately 427 deaths. When we look at the whole larger picture here, whether it's total number of cases by date or even when we're looking at everything by cases with the onset of symptoms, it seems as if those numbers are starting to taper off on a lower trajectory, which is good as far as the county outlook. When we look at the statewide outlook, 32,000 cases statewide, 2,400 deaths statewide. Again, the concentration of those deaths, 82% are here in Southeast Michigan, and again, 77% of the cases just here in the Tri-County area.
And that's the important thing, is the statistics, the numbers. I mean, I think it's what's driving a lot of the decisions, to get to where we're at as far as closing businesses, closing schools, nationally, state by state. I think whether you're Governor Cuomo, the President of the United States, or Governor Whitmer, the question becomes, how are we relying on these numbers, and where are these numbers on a daily basis? So we're starting to see it move in a direction that's going to give them a chance to start making some different decisions, maybe start going into that phase one, if you will, and kind of see what happens there. But for the most part, we're going to continue watching numbers. And speaking of numbers, one of the things we get asked a lot is, we know that there are many people that have had the COVID virus have recovered from it. And it don't seem like there's a uniform way of making the determination as to how do you say that somebody no longer has it. And we've been asking that question. Really, there's no, I guess, national standard. But we found that the state has finally made a determination that they're going to do it based upon a 30-day process. In other words, if somebody that was tested positive for the COVID virus, after 30 days, it's assumed that they no longer have it, again, if a death didn't occur. So in other words, if somebody had passed away as a result of it, obviously that would be the challenge to the numbers themselves. So we're going to start reporting those numbers. We're going to start putting it out there based upon this assumed formula that we're seeing the state use, kind of following their guidelines.
Mark, this has been a back and forth process with the Department of Health and Human Services at the state level, working with our local health department and local health departments across the state. As we're getting new standards to classify data and track community metrics, we're going through and doing the quarterbacking on our side. What did the numbers look like 30 days ago? What did the deaths look like 30 days ago? Looking at that recoverable metric and how we work that into the track and spread of the virus and what it means for future testing and care with individuals as we're getting more resources in that arena.
Yeah, because there's two issues with that. One is you're not going to go back and test everybody that had it to make a determination if they no longer have it. That's just not feasible. It's not going to happen. And at some point in time or some way, you're going to have to figure out how do you make that assumption. So health department can't call back, what do we have, 4,500 people, I guess, right now, cases. Impossible for the health department to keep up with that. And so with that being said, we know there aren't still 4,500 people since the onset of this that still have the virus or the COVID virus within them. So there is this recovery factor, and as I mentioned before, we're going to start reporting that so people understand, kind of where we're at.
Mark, I think the symptoms and the screening is a big part of that. We always talk about that personal responsibility, the social distancing elements, the stay home, stay safe. That's right now where we're going to be laser focused on that for about the next week and change as we look at what steps the governor may take as future executive orders or emergency orders come into place here. And then, as you said, looking at that phasing and tiering system, whether it's opening up the economy, whether it's loosening some of these restrictions. But as we're continuing to look at the data, the recovery statistics that DHHS is looking at covering, and some of these more testing metrics that they're putting out there, these things that are coming in, variables in and out, but I think we've got a good handle on it right now. We're starting to see some more favorable trends with regards to the spread of the virus, and our health department is definitely leading the charge in that care element.
And speaking of the health department, they're very much connected with our healthcare providers, in particular the 3 hospitals here in Macomb County that they've been working with closely, and we're finding out that the demand for hospitalization has kind of declined. It's not as prominent, and as well as the testing. So we're seeing a decline in both the testing and as well the hospitalization. So that's a good sign. I mean, those are 2 positive trends, I guess, if you will. And there's obviously, we mentioned before, and we'll continue to mention that, availability of testing for anyone who needs to get tested, whether you have a primary care physician or not. There's an ability for you to get tested. MacombGov.org, you can actually log on and find the icon of how to have that, how to get a test somewhere here in Macomb County. So the availability is there, but we're seeing the demand really isn't there for people wanting to get tested anymore.
You know, Mark, in late March, the greatest concern was with regards to the surge capacity in the hospitals, whether it was sourcing material that we needed to care for individuals, whether it was ensuring we had bed capacity, ventilators, all those things were a part of that first conversation. We've met that surge. I think is where we're at right now, again, starting to be on the downward trajectory or a little bit of plateau there. But also with regards to testing, I think it's what happens next. As we begin to open things back up, as we see what happens if there's a potential spike or if things level off on that end, that's where we're really trying to understand where is the next response that we have collectively with our healthcare providers, our health department, our emergency operations center, and our first responders and public safety folks too.
Yeah, and as you mentioned, obviously those personal protection equipment, that early on was a big concern, making sure people had enough masks, trying to figure out how do we get the face shields and then the gowns. There were people that stepped up to the plate to really help out with that. Some of these manufacturing facilities here in Macomb County, Southeast Michigan, retooled themselves to make that available. In fact, there were people that were volunteering to make some of these. We mentioned different companies and folks, and even our kids at the youth home were making some of these masks for that. So, I go back to the volunteer thing because it happens to be National Volunteers Week, and we got volunteers at many different capacities. Internally within the county, the support we got is specific with the food service and providing people access to food. Extremely important during these difficult or challenging times. Whether it's our Meals on Wheels program, the food pantries, at distribution centers throughout the entire county, we're getting an incredible response from people within the county's government that want to help support that. I was at one of our locations today where they had to drive through people coming up that needed that support. Sad as it is, it's a reality. And so whether you need that type of support or you know someone who may, please go to macombgov.org. There's an icon there, and it talks about food. Whether it's restaurants that are open, food pantries, distribution centers, and even the support they're getting from the schools, which has been absolutely incredible here in Macomb County with our school districts.
Mark, it's hundreds of volunteers. It's thousands of individuals that are getting these resources throughout our community, and it comes from that close network of partners, not only from the great county employees that we have that work across all divisions here in Macomb County, but obviously our Community Action Agency, all the nonprofit agencies that help there on the food pantry side, our intermediate school district and the local districts. It's a community response. And now being in National Volunteer Week, it's a great opportunity for us to celebrate the impact that's had, not only to help folks weather this storm for some of the immediate needs that they have, but also look how we have a more systematic response coming here in the future.
Yeah, we have great support from people within the county government as well as outside. I mean, I think that's what this county is all about, stepping up during challenging times and want to be part of the solution. So we just wanted to give you a quick update on what's going on here within Macomb County, and we appreciate you tuning in. And also, as we always mention, please keep yourself and your family safe and healthy.